and those who are live here, our viewer and our listener at home. We want to welcome you to the rescheduled national briefing of PTF on COVID-19. Today is Tuesday, 3rd November 2020. It's a pleasure to welcome you to today's national briefing. And as usual, to kickstart today's briefing, may I please request the chairman of PTF, who is also the SGF, to now kickstart the briefing with opening remarks. The SGF, sir.
Ladies and gentlemen, gentlemen of the press, our apologies again, because we ought to have started this meeting at the media briefing at 4 o'clock. However, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for today, Tuesday, 3rd November 2020. The Presidential Task Force could not brief the nation on Thursday, 27th October, which was Eid al-Mawlud and had been declared a public holiday in our country. Similarly, we could not brief yesterday, Monday, 2nd November, due to other exigencies, including engagements with the National Assembly on the 2021 budget. These are very trying moments and quite a lot of conflicting engagements. We nevertheless use this opportunity to felicitate with the Muslim Ummah on the commemoration of the birth of the Holy Prophet Muhammad. And as we remember his birthday, we pray for mercy upon humanity and protection against the coronavirus pandemic. May the Almighty God accept our prayers. The Presidential Task Force continues to monitor situations around the world and will continue to draw your attention to the rising number of cases. Global cases crossed the 46 million mark, with USA, India, and Brazil accounting for 50% of all global cumulative burden. A number of countries in Europe have been forced to order their second lockdown due to spike in cases. The reasons for concern include the fact that as of Monday, 2nd November 2020, global statistics showed the following. Global cumulative cases now, as of today, is 47,387,837. Global number of days is 1,212,479 fatalities. The UK and France have continued to struggle with record increases in numbers and have reintroduced total lockdown to control the spread. The United States continue to witness record daily increase in number of confirmed cases, especially given the fact that it is in the middle of a presidential contest. The African continent has at the same date recorded a cumulative total case count of 1.813 million and 800, including 43,461 deaths. And unfortunately, the head of the World Health Organization is reported to have gone into isolation out of abundance of caution and the need to underscore the importance of contact tracing and also ensuring compliance with advisories from the World Health Organization and other national bodies like the NCDC and the Presidential Task Force. When we say isolate, it is imperative that you isolate. When we say quarantine, it's imperative that you do that out of abundance of caution. The Presidential Task Force, as at the last briefing, cautioned on the need to avoid complacency on account of the low number of infections published daily and the possibility of a second wave. That advice was premised on the fact that risk perception remains very low and sample collection has been on the decline. In the midst of all this, the nation has experienced several large gatherings, particularly events during which non-pharmaceutical innovations were not really observed. The situation in Europe and the reports from the USA showing the consequences of non-adherence are quite vivid. The Presidential Task Force is highlighting these issues repeatedly because we remain at risk of importation, having opened our airspace, a massive spread as a result of the protests by the NSAS and the continuation as exploited by all sorts of tendencies in the acts of looting and cause of mayhem all across the country. The next week or two remain critical because that is when we are expecting to see if those events were super spreaders. The PTF has noted with sadness the failure of Nigerians who arrived from abroad to present themselves for the in-country PCR tests, which they signed up to and paid before arrival. Statistics emerging from our records show that only 1 out of 3 passengers have shown up for the in-country test. 1 out of 3 passengers. That's a dismal number, and it ought not to be so. As you may recall, the PTF announced the guidelines on the reopening of the airspace and the obligations of arriving passengers. The Presidential Task Force similarly announced sanctions as a consequence of any infraction. Having observed serious non-compliance to the level of 65%, the need has arisen to activate the sanctions, which includes the suspension of the passports of such defaulting individuals for a period of 6 months minimum. The National Coordinator will elaborate further on this. That was part of what they signed off to, and if they do not obligate themselves to conduct the in-country tests, they will be endangering their loved ones and their communities. And we need to activate the sanctions. As part of the strategy of the Presidential Task Force to deepen community engagement, I addressed an emergency session of the National Executive Committee of the National Council of Traditional Rulers this morning. The contributions of our traditional rulers to the successes so far recorded in the national response cannot be overemphasized. Accordingly, I acknowledge and thank all our traditional rulers for their support and urge them to continue to do more, especially in the areas of risk communication and community engagement. Adherence to the non-pharmaceutical intervention measures and the need for people to come out for testing were also emphasized. Finally, I wish to inform you that the Presidential Task Force has revised its meeting and briefing frequency to once a week to allow members to carry out other functions and activities, because invariably all the ministers and members of the Presidential Task Force are currently engaged with the issues of engagement at the National Assembly and dealing with other issues particularly engagement as an aftermath of the End SARS protests. So we will not have the benefit of having all the members at the same time for the number of days that we want them to meet to continue with the briefing. But we will make sure that at least once a week we meet and also have an opportunity of speaking through you to the entire nation. However, this does not preclude the need to call for emergency meetings and briefings when the need arises. With effect from Thursday, 5th November 2020, therefore, the national briefing would only hold once weekly. Let me use this opportunity to once again thank all our collaborators, especially the media, for the sacrifices, understanding, and the dissemination of information to all Nigerians. I now invite the Honorable Minister of Health, followed by the DG Nigerian Center for Disease Control, and the National Coordinator to update you from the technical perspective. Once more, I thank you for listening and wish you a pleasant evening. Thank you.
On COVID-19, honorable ministers, cabinet secretaries, national coordinator, director general, directors, ladies and gentlemen, a total of 63,036 confirmed cases have been recorded as of today, 3rd of November 2020, out of 627,600 persons tested so far for COVID-19, with 59,328 cases treated and discharged. We have sadly lost 1,147 persons to the disease in 36 states and the Federal Capital Territory. We currently have 2,561 active cases, which are being managed either at home or in treatment centers. We are also concerned about the decline in the testing rate in several states of the Federation. Records show that only Lagos and the FCT have met the testing target of at least 1% of the population. Plateau, Rivers, and Gombe have reached 50% of the target each, while 25 states are yet to reach 25% of the population, of the target of the population. We do not have the confidence to draw firm conclusions on our status till this situation improves. Our concern is heightened by several emerging factors that challenge whatever gains we may have made in recent months. Number one is the inevitable need to reopen air travel to stimulate economic activities. Number two is the imminent reopening of schools and youth service operations, again necessary for restoration of social order, but which global experience links with spikes in COVID infection rates in most countries. The effect of recent social agitation and unrest, with the attendant disruption of services and the widespread breach of infection prevention protocols. And fourth, the growing lackadaisical attitude to COVID-19 and disregard for safety and infection prevention and control measures, which I must admit is not peculiar only to our country. Preliminary reports show that contact tracing and case finding have declined in states with a consequent reduction in the number of persons tested, and I therefore renew my call to all states and stakeholders to step up testing capacity to help identify positive cases for isolation and treatment, and to protect the rest of the population, which is the duty of government. I wish to particularly emphasize the need to protect the elderly and vulnerable, those who have pre-existing conditions, who are the most affected when it comes to fatalities. In this connection, the Ministry of Health will next week launch an advocacy campaign in which a representative of the Honorable Minister of Health will visit hotspot states that require encouragement to discuss their specific challenges and needs and find ways of stepping up sample collection for testing. I have also directed the Department of Hospital Services to work with NCDC to design criteria and a strategy for sentinel surveillance with sample collection at outpatient units of federal health institutions and their outreaches to augment and support the work of state authorities. This should improve the test volume considerably. The evolving global situation of COVID-19 gives us much reason for concern, with over 2.8 million cases reported in the last week, with half of the cases in Europe. The UK, France, Germany, Spain, and others in Europe have resorted to lockdown and other measures to control the pandemic. With the high volume of air traffic between Nigeria and Europe, we are examining the associated risk factors for Nigeria. The PTF set up very stringent criteria and measures so far to limit COVID-19 importation. Nevertheless, 18 travelers out of over 78,000 arrivals so far were found to be COVID positive during the second screening in Nigeria. This is a relatively small number, but it could increase with rising volume of flights. Moreover, it is estimated that traveler compliance with second testing after arrival is very low, or rather not very low, but it's considerable, the lack of compliance. And this is a challenge we are responding to in innovative ways as we work constantly to improve the arrival processes for better protection of citizens. To improve function at international air and sea points of entry, the Division of Port Health Services has been directed to work with NCDC, the Ministry of Health Planning Department, and relevant agencies of the Ministries of Aviation, Interior, and Transportation to bring up new design of structures and protocols that will enhance their ability to function more efficiently and effectively and ensure reduction in the risk of importing infectious disease, especially COVID-19, by promptly identifying, isolating, and processing suspected cases before they enter the country. While we still evaluate the impact of recent unguarded mass gatherings in various parts of the country as a risk factor for spreading COVID-19, our concern is that we may find a spike in confirmed cases with the widespread disregard for preventive measures associated with the large gatherings and mass movements. We must take effective responsibility and collective responsibility for each other's actions if we are not to experience the upsurges in new cases that has been experienced in many other countries that can be a throwback to conditions worse than the present. An appraisal of Nigeria's position in the global COVID-19 space has been prepared by the Ministerial Expert Advisory Committee on COVID-19 and will be discussed at PTF before release to the public. All citizens are enjoined to do their bit by adhering to non-pharmaceutical preventive measures like appropriate wearing of face masks, physical distancing, good hand and respiratory hygiene, and avoidance of non-essential travel and visits. We should make use of technology that makes it possible for us to connect virtually with friends and family. In this regard, citizens are also again advised to postpone all air travels to high-burden countries in the world, including Europe and America, except it is absolutely necessary. The better we are able to control importation of fresh COVID-19 cases to our country, the easier we can control in-country spread and return to our normal life. We have continued to work with the World Health Organization to assure Nigeria's access to vaccines as soon as it becomes available. The Ministry of Health is preparing to sign a memorandum of understanding with a first-line pharmaceutical company in Nigeria on a public-private partnership to set up a modern vaccine production company in our country and to work towards licensed indigenous production of vaccines. Thank you for your attention.
Of the Presidential Task Force, honorable ministers, colleagues, gentlemen of the press. So thank you again for coming. For this press briefing, we'll quickly deal with three topics, some of which have been touched on by the honorable minister already. Firstly, around travel, schools, and NYSC camps. Firstly, around travel. Firstly, to be honest, whether you're in Nigeria planning to go out or you're in the West planning to come down, to be honest, if you really don't need to travel, please don't travel to any of these high incidence countries right now. If you have to travel, then the small inconvenience of filling forms, testing before coming and testing on arrival is absolutely necessary to keep and protect the small gains that we've had and made in our country. Yes, there have been some complaints about the process, but we have to implement this testing prior to travel and on arrival to keep Nigeria safe. And to remember, the reason that we have instituted these measures is to really protect the gains that we've made. We've been relatively successful in the last few months in preventing a further escalation of cases in Nigeria. And that was the reason we implemented these measures. And therefore, those measures have been successful up till now, like the Honorable Minister just said, in limiting the number of cases, positive COVID cases that have come into the country out of the small proportion of people that are actually reporting for their second test. So measures will now be implemented to enforce the taking of that second test. We know there are some difficulties, but we'll work very hard to make sure they're alleviated. The post-arrival test is required to cover any infection from the 7 days prior to travel, infection during travel, and infection on arrival. So it's not a nice to have, it's actually a very important step in protecting our country to ensure that that second test is done. And that is also why we have to isolate for 7 days after arrival. So these are very necessary small steps. Now, there have been a few complaints about the reason for payment, but we have explained this. Travel is mostly a choice, and if you have to travel, we, at the moment, can't afford to use public resources to support your testing, so we encourage you to use the private labs to continue to do this. The prices range from about below 40,000 to 50,000, all of this go directly to the private labs, some administrative costs to the states. None of this comes to the federal government or any of our agencies. So this is really just to manage the process of testing itself. Over time, there might be opportunities to push this down a bit further, and we're working with all the stakeholders to do this as much as possible. When you do arrive in the country, it is also important to adhere to the 7 days rule. We know for a fact that many people are not doing this on arrival and have proceeded to engage in the activities for which they have come home to do. Sometimes this includes weddings, burials, social functions that put other Nigerians at risk. It is a small price to pay right now to protect these gains, so we keep encouraging those that have come back to Nigeria from high incidence countries, even when they think they are not infected, to please adhere to the 7-day requirement for isolation on arrival. It also doesn't, you also have to continue carrying out the other measures, including wearing a mask and distancing from others, and really, those coming back have an increased responsibility to do that, not a decreased responsibility. So it's very important to adhere to these measures. On our website, we have details. If you have any question, please write us an email on travelportal@ncdc.gov.ng. We have increasingly improved the frequently asked questions on our website based on inquiries we get from members of the public. That website is updated almost every day. We also urge all travel agencies, airlines, the Nigerian High Commission to place pop-ups on their websites that redirect travelers to the NCDC website where all the information they require is available. We will continue over the next few weeks amplifying these messages through all communication channels possible so that we protect these our gains. We see numbers rising across the world. It is not inevitable that we will have a second wave in Nigeria. It will depend critically on the work that we do together to prevent this from happening here. The second topic I'll touch on quickly are schools. Schools have now reopened across the country. We've worked very hard with our colleagues in the Federal Ministry of Education and states across the country. Set up very many measures to protect our kids and ensure that as much as possible we prevent further transmission. But we can't just rest on our oars now. So we are suggesting both a few measures that every school in Nigeria has to remember to do as much as possible. We understand that resources available to schools are different, so not every school might be able to do it at the same pace. But every school needs to understand what they should aspire to do. So 5 things schools themselves should put in place is up-to-date information on the health status of every student, a clear communication plan of what to do when there's an outbreak or cluster or even a single confirmed case in the class. So the school knows exactly who to tell, when to tell, and what to do. A triage station is important at the beginning, at the entrance to the school to screen patients and make sure to screen people coming into the school, and if you're sick, have a place to put them. Continue training on how to manage a holding area for sick staff or students and where to keep PPEs that are being supplied, and the identification of a sample collection site that they can access. So these are very important for every school. These are just reminders. All this information is available on the instructions that we have collectively developed for schools reopening. But the key thing is not to remember that the responsibility not only lies with schools, but with parents. So all staff and students 6 years and above are expected to wear face masks. We're not going to go around schools policing this. We expect parents to make sure kids have access to masks before going to school. It's a price we have to pay for the reopening of schools. The alternative is to keep them shut, something we don't want to do. Ensure classrooms are well ventilated, windows are as open as possible. Ventilation has been shown to be a critical way of minimizing the risk of infection. Provision of hand washing facilities should now be a no-brainer. We know there are some resources involved, but that's something we all have to work towards. Communicate to everyone through meetings, communication platforms, WhatsApp messenger platforms, PTA meetings, so that we collectively hold ourselves accountable as parents and teachers and ensure that each school has a trained team that can respond. So these are just a few reminders of what we need to continue doing in our education settings to prevent infections. And finally, we've been working extremely hard over the last 2 months with the Nigeria Youth Service Corps and to reopen youth service camps. We've made a lot of progress to ensure that we can do that safely. We know that corps members are normally young, mobile populations, and the data show us that at the moment their risk perception is the lowest among all population groups. So young people feel that they're not at risk. And yes, the risk is a little bit lower of having severe infection, but low risk doesn't mean no risk. And we have to work together to support the parents that we might be exposed to post-camp as well. So again, we're counting on not only the young people going to camps, but parents, because every young person going to camp will be living at home where he or she has parents right now. So we need the parents to support young people living home to go into NYSC camps, to do what they have to do, encourage them, support them as much as possible. Everybody reporting to camp will be tested with one of the new antigen-based tests. The process of procurement is almost complete, and so we'll be testing everyone. That will enable us, firstly, keep our camps safe, but also help us understand what is going on in the rest of the country. Risk assessment, IPC risk assessment of all the camps has been happening over the last few weeks, and through it, advise infrastructure and other support to make the camp safe. So parents should rest assured that we've done everything possible together with other stakeholders in this to ensure that children are younger, people are safe in camps, and there won't be any big outbreaks. If there are outbreaks happening, we know exactly, we have plans in place in terms of how to respond. So together with the PTF, the ministries involved, the NYSC themselves, we've worked very hard to ensure a safe reopening of NYSC camps across the country. In addition, we've launched something called the IPC Core Vanguard in all the states. So these are young people interested in IPC themselves that are being trained. So there's a kind of self-management and self-regulation in the camps as they open. And we continue to use all means of communication, traditional and social media, to get the word out. So I'll pause there. We are not out of the woods by any means. We're faced with a situation where things that we need to survive are also the things that put us at increased risk. It's a very difficult situation to reopen our economy, to reopen aviation, schools, NYSC. These are things that we need to restart our society. But they're also exactly the same things that put us at increased risk of infection. So we have to do these things a little bit more carefully in order to mitigate this risk. So please, let's continue working together. We have so far managed to reopen our offices, reopen our airports, reopen our schools. The next step is NYSC camps, but now is not the time to drop the ball. Rather, we need to tighten our belts and keep pushing to keep infection rates as low as they've been in Nigeria. Thank you very much.
The chairman of the Presidential Task Force, honorable ministers, members of the PTF, gentlemen of the press, good evening. I think most of the things I wanted to say have already been said by the Honorable Minister of Health and the DG and CDC, but I'll still go through a couple of points. First of all, testing. So this week marks the beginning of a major initiative of increased testing for COVID-19 in the country. And congratulations to Lagos and FCT for hitting their target of testing at least 1% of their population, have already gone beyond the 50% mark of the target. But a large number of states have not even reached a quota of this. And we continue to be very concerned because we can say with a fair degree of confidence that we know what is happening in FCT and Lagos when it comes to COVID, but we cannot say the same of other states. So this week, and progressing from this week, we thank all state governments for their cooperation and effort towards opening up new sample collection centers across the country. We have given resources to the state governments. Every state has received at least ₦1 billion. The state governments have received the single largest bulk of the PTF funding that has come from the federal government. A total of up to 50 billion naira went to the state governments. So we now have enough resources at the state level to be able to push for increased testing and improved surveillance. And we'll continue to work closely with state governments and urge them to make use of these resources for the purpose that the federal government has given. We have to invest in making sure that the pandemic comes down. There's no doubt we have not flattened the curve yet. For those of us that follow the numbers very closely, despite the fact that we are not testing enough, but we know if you follow the numbers on a week-to-week basis, you probably would have noticed a change in the trajectory over the last 1 week based on the numbers we are releasing. So please, if you have symptoms, get tested. There is nothing to be afraid of. If you are positive, we will take steps to make sure that you are managed properly, and it will stop you from infecting your loved ones, your work colleagues, etc. And all of us have a role to play. Over the last few weeks, we've taken the initiative of opening up our economy. The combination of opening workplaces, opening schools, opening markets, opening our airports, and a major demonstration without any non-pharmaceutical interventions is a toxic combination for any country already in the throes of a COVID pandemic. Therefore, we should please continue to be responsible for our actions. We should please continue to protect ourselves and protect those that we live with or we relate to. The PTF is monitoring very closely the situation in the European countries that are now struggling to cope with their second wave of COVID-19 infections. Countries like England and France have already gone into a degree of lockdown as the number of cases continue to rise. With up to 7,000 passengers potentially coming into the country when we fully reopen our airports, the risk of reintroduction and a second wave of COVID-19 is real. And this is why we cannot rest our oars. Our airports, the port health services, are the first line of defense when it comes to dealing with pandemic. So we'd like to remind travelers that it is absolutely essential you have double testing before boarding and testing at day 7 after arrival in the country. When we looked at our data for the first 5,000 plus passengers coming into the country, 105 were positive. All 105 were positive at day 7 of testing. whereas they all had negative PCR results on arrival. And this is in a situation where we have not even opened all our airports. Nigeria continues to have one of the most strict processes when it comes to entry into the country, when it comes to policies relating to COVID-19. And we're proud of this policy because this is what has been minimizing the risk of reintroduction of infection. We know that there have been challenges with the portal. We continue to work very closely with our IT to make sure that passengers have a pleasant experience. But there's also responsibility. A situation where a passenger pays for a test and knows that the test needs to be done at day 7 and fails to present for testing, despite reminders, is very difficult to understand. And the reason why we test at day 7 is in order to pick up those small percentage of individuals that would have been incubating the illness on their way into the country, and also allow people to stop isolating at day 7. We know there have been issues about the cost of the PCR testing and why it's being done in the private sector. The cost of the tests is determined by negotiation between the private laboratories and the state governments. The role of the PTF is to make sure these costs are not excessive. We have taken it as a priority to continue to push the cost of the PCR testing down. When we started off with the Abuja portal, the cost was about 42,000 naira per test. It's now 39,500. Just last week, we directed the Lagos portal to stop charging passengers outside Lagos 50,000 naira plus, and the passengers outside Lagos will go onto the Abuja portal for the southwestern states, which will now be 39,000. Kano is charging 36,000 per test. The Imo portal is charging 38,000 naira per test. This is all based on negotiation with the state governments. But overall, our plan is to continue to push the cost of the PCR test down. We continue to supervise the private laboratories closely to make sure that they fulfill their own part of the bargain. We have opened sample collection centers or teams working with the private laboratories throughout the country, so that passengers do not need to move around in order to have a test at day 7. But as mentioned by the chairman, we have to make sure our quarantine rules are strict if we want to stop transmission in country, if we want to stop repeated reintroductions of COVID-19. We are looking at our data, and over the next few days, we will be publishing a list of the first 100 passports that we will suspend for passengers that have failed to test at day 14. We will recheck with these passengers to make sure that they have not had a test by day 14. If there is no reason for them failing to do so, we will suspend the passports for 6 months. This is the only way we can enforce testing at day 7 and make sure that we follow up those that are infected. The alternative is to stop flights from countries with high prevalence. And I don't think this is an alternative that is palatable to most of us, because we need to keep our economy up and going. And for this reason, we will start enforcing what we have right at the beginning of this protocol stated, and which we already have approval from Mr. President to do so. These measures are not punitive. We know that the pandemic is not over yet. We cannot retrogress back to where we were before. There's a very real risk that we could end up with another second wave. And we do not want to find ourselves in the situation we were back in March, April. So let us please be responsible, and let us please protect ourselves and our loved ones. Thank you.
Which is about FMC Lokoja. As you know, that medical center was shut down when a group of people stormed the place and drove everybody out, scattered the office, and sent patients and staff scampering. The issue has not yet been resolved. The staff agreed the other day, about I think a couple of weeks ago, I met with the medical director who was preparing to reopen. But at the same time, we are still trying to iron out issues with the governor, who has his own complaints about the operation of the hospital. And the issue is being handled by the Minister of State about the differences between the governor and the medical director. We shall form a team that will go to Kogi to go and iron out the service so that the people of Lokoja, people of Kogi State can begin to get treatment and get medical attention and don't fall behind in the indices. Now, the other question is about pregnant women and COVID. We do not have data yet. We must know that COVID is with us only since January, or rather since February here in Nigeria. I'm also not, I'll probably leave that question to WHO. WHO, they probably have larger data than we do because they're looking at the whole world. And perhaps NCDC also has data from the world. But here in Nigeria, we do not have enough to actually be able to make a categorical statement. With regard to post-COVID illness, yes, it has been widely reported. There are people who fall very ill. There are those who are not ill at all. There are those who get very ill. And among those who get very ill, there are those who recover completely. And there are those who have lingering symptoms. Many of these lingering symptoms are said to be sensorineural. They affect the senses, the feeling, ringing in the ear, headache, and feeling of anxiety. Again, this is a subject matter that is being investigated, is being studied. It is said that those who have these symptoms are those for whom the treatment was particularly long. If the treatment took a long period of time, beyond 17 or 20 days, then you have, the more these symptoms will be. But again, those who have larger data, again, WHO will also like to say something about that because they look at all these things from a global point of view. But from our own experiences here, nothing categorical can be stated because the number of cases are few. And I spoke with the Chief Medical Director of Gwagwalada Teaching Hospital on the subject matter, and he has observed it himself, but they're not enough for him to be able to make any generalizations on it. But it is present, it does exist. The number of people who suffer from it is not yet very clear, and then the follow-up to be able to make scientific statements on it is probably still growing.
On which we recommend the wearing of masks. Actually, you said we brought it down from what the U.S. recommended. The U.S. is one of hundreds of countries around the world, and before we decided on our 6 years, we did a literature review, looked at what several countries were doing, looked at recommendations. There's no exact science on whether it's 6 years, 7 years, 10 years, or 11 years. We have to make a decision. Every country has to make a decision on its own reality, on ages where children are in school, on practicability of enforcement in schools and things like that. So many countries also use 6 years as a cutoff. We decided to use 6. The US have their reasons for choosing 10. but they may not be the best example of appropriate measures to prevent COVID right now. So we continue to make decisions based on our own reality and on the evidence available to us, taking into considerations what every other country around the world too is doing, especially those that have been more successful in controlling the outbreak. Second, say that again. Of course, there's a risk of that, but whether the risk is more in 7 years versus 6 years is what we can't disentangle with the data that we have right now. But the risk of transmission, the data available to us right now does not. There's no increased risk of transmission based on age. Children, young people can all transmit this infection, so we have to be careful around the decisions that we make. And schools are particularly vulnerable because people are indoors. In Nigeria, we're a bit luckier in some way that sometimes most schools are ventilated through open windows, and therefore there's a lot of ventilation within the classrooms in most schools, which in a way is an advantage when it comes to the transmission of this virus. On your second question around guidance on social distancing, it's really unfortunate if any part of the country is letting down its guard in this area. We've been fairly successful with the measures that we've implemented, especially indoors. So we continue to encourage everyone to continue doing this, especially where where you're indoors. You need to wear your mask, you need to continue staying apart. There's a very fascinating graphic that's been circulating around cheese, but cheese is not the most easiest way of demonstrating the effectiveness of these measures. But what it really says is that these measures are most effective when they are layered against each other. So mass distancing, ventilation, all of them. None of them is extremely effective on its own. They are effective when they are done together. So we continue to encourage everyone to please guard our numbers, guard our relative successes. Our economy cannot sustain an explosion of cases, so we must guard these gains very carefully. It's very easy to think, yes, we have succeeded, therefore we let down our guards. Everybody's been working hard for 10 months now. We need to keep pushing for a few more months until we have some other tools in our arsenal. So, final message on this, it's too early to let down our guards. Yes, it's difficult. Yes, we're getting to the time of the year where we're used to gathering, to celebrating, to coming together. We can't afford to drop the ball this year. This is a special year. And like the chair has said severally, the prize this year is just to stay alive. And so we mustn't take that for granted. And so this is really an appeal directly to all Nigerians watching this. Please don't let down your guards. Let's keep doing what we have done throughout the year. We recognize how hard it has been for all of us together, but let's keep pushing on this until we have those tools that we're working very hard collectively as a global community to develop. So please, this message, it might sound boring, it might sound repetitive, you may have heard it many times, you may be upset with many of us for saying the same things over and over again. We wish there was a different, we wish we had something else to offer you right now, but we simply don't. So we have to be honest with every Nigerian watching this to keep doing these things for now and protect the gains that we've had in Nigeria. Thank you very much.
Thank you very much.
Your question, I just want to complement the responses from the Honorable Minister of Health regarding the spike in stillbirth. Yes, we are aware that there was a large study in the Lancet that was published, which demonstrated a 50% increase in stillbirth in some settings. But I would like to emphasize that the study also said that these stillbirth were not linked to infection with COVID, but rather what was observed at the same time, it was reduction in access to health services, mostly as a result of the lockdown. So the researchers think that what they saw was a result of the fact that the pregnant mother couldn't reach, they might have some underlying condition, they couldn't reach the hospital in timely fashion. And the consequence were the same, like what we are seeing now with the reduction in immunization coverage and other essential health services. And that's one of the reasons why WHO is insisting on ensuring that we maintain access to essential health services as we are fighting COVID-19. The other part of the question is the long-term consequence for COVID-19 infection. So there are more and more reports of long-term disturbances to health on heart condition, on the lungs, on the brain, on the blood, the muscles. So the COVID-19 is proving really to be something we don't know much about in terms of how it affects the health. There are people who still feel that they cannot exercise the way they used to do before they got infected. There are people who experience palpitation. There are people who experience like prodroma for stroke and all sorts of conditions. I'm sure as we learn more about the disease, we should be able to characterize those manifestations, long-term manifestations, which are being documented with COVID-19. Thank you.
On the responses from the members of the committee, but just to underpin where we are now. Yes, our numbers are low, but are we out of the woods? No, we're not. COVID-19 is still virulent, is still very dangerous, and is spreading. Then it depends on how we react. Like Dr. Chukwe rightly said, I have said over and over that your gains and your credit for this year is to remain alive. Whatever the plans you had at the beginning of the year, as long as you survive 2020 and cross over to 2021, then you can think about those plans and programs. But the entire 2020 has been disrupted. The entire world has been brought to its knees, impacted negatively on our economy, on our social life, and exposed the weaknesses in our systems. And I think we must have that at the back of our minds as we tread with utmost caution on our responses. The truth about it is, the vaccine would come, but at a later time. For now, the only measures we have, which we must continue to deploy and insist and persuade our people to comply with, are the non-pharmaceutical measures that have been put in place. Wear your mask, quite uncomfortable. Quite uncomfortable. When we started this journey with all of you sitting here, it was quite a very uncomfortable session. But over the last couple of months, we've come to adapt to it. And we can see the benefits, we can see the gains. And oftentimes, I have repeatedly said this. The number of fatalities in Nigeria, for some of us, that's not a statistics. I can place faces to those numbers. I've lost colleagues, classmates, friends, professional colleagues, political colleagues, relatives. Some of them so endearing to me. Some of them, as a matter of fact, I stand today here as Secretary to the Government of the Federation as a result of the mentorship I received from them, either as school teachers, principal, political mentors, those that those that were trailblazers that opened the way for some of us in our communities to be able to ventilate our political aspirations. So it's quite a difficult time, and I appreciate it. But our counsel to Nigerians is that we must take responsibility to what happens in the remaining part of this year. And we must learn from what is happening in other climes. Europe would have thought that they are done with COVID-19, aggressively pursuing the issues of vaccine, opening up and relaxing some of the non-pharmaceutical interventions. The current trend exposes the fact that this second wave could be more dangerous than the first one. Last week was the worst week for the United States of America in terms of numbers, cumulatively. Even at the peak of the first wave, they never recorded 100,000 cases a day. But last week, there was some consistency from 80, 83, 84, 85, until they got to the Rubicon of 100,000 plus cases recorded in a day. It has become the most important subject that will even determine probably the outcome of the election. So it's a very serious business. And I want to urge us that as we communicate with our fellow Nigerians, we must emphasize that point, that we are not out of the woods yet, and we must continue to drive home this point. I know people are exhausted. COVID has been a very disruptive and exhausting time for each and every one of us. You can't receive friends in your home. Celebrations have been disrupted. Our wards are graduating online. Schools have become virtual. By nature, Africans and Nigerians particularly want this physical contact because that's how we are. That's what we are made of. But that definitely must cease for now so that we can quickly transit, if we can calm this thing down as much as possible, and eventually open up when we have reason to do. Assuming vaccine is available in the next 1 month, how many people will get the vaccine in the next 6 months? It's going to be highly competitive. So I'm not looking forward, let me tell you the truth, as a person, I'm not looking forward to the vaccine. I'm definitely going to take the vaccine once it is available. But for now, I must survive to get to the point that I will take the vaccine. So my major consideration is to make sure that I survive before we get to the point of the vaccine. Dr. Sani has given some further explanation as to the actions of sanction that we intend to put in place. Assuming you have 30 passengers and just 1 out of 3 turn up for the in-country test, which has eventually, it has been paid for. So what stops you from going for the test? So that we can have a balanced picture of what we are dealing with. Because the major concern now, in addition to the community transmission that is going on, is the one that is going to be reimported. That's our major concern, reimportation of the virus afresh. You know, we have joked about it here severally, whether the one we have in country is not as potent as the one that comes in. So let's manage the one that we have in country and not allow for reimportation. Those that have not carried out the second in-country test will be given an opportunity to explain why they have not. And certain considerations will be put in place. But if it is confirmed that you just decided that you are not going to take a second test, in spite of the public health challenge that it poses, definitely sanctions will be applied. So I want to thank you for this evening and I wish you a very wonderful day. As you watch the American elections, I know some of you will stay awake all day to ensure that you cheer up your parties by proxy. And I wish you, may the best man win the elections. Thank you. Thank you.
Viewer at home are looking forward to this segment. It's a pleasure at this time to invite the Permanent Secretary, General Services Office, Office of the Secretary to the Government of the Federation, Dr. Nnamdi Morris Berry, to please give us the takeaway message.
The honorable ministers here and other members of the PTF, gentlemen of the press, ladies and gentlemen. Today's briefing has actually anchored around passionate appeals from all speakers for us to take a number of measures. First and foremost, we are meant to remember that we are not yet out of the woods. And so, we should take responsibility for all our actions to stay alive. You remember that a lot of openings have been made in the recent time in order to reactivate our economy. And we're also reminded that these openings are also sources of risks to us. So what that means is that we have to tread with caution. The openings, like reopening of schools, reopening of airways, reopening of NYC camps and the rest of them are sources of very high risk as far as this pandemic is concerned. So we have to be very, very careful. And what this means is that testing remains very critical, very key to our survival. So you are advised that if you have symptoms, if you have any symptom, please get tested. And you all remember that low risk does not in any way translate to no risk. So we have to be guided. And if there is no pressing need for you to embark on any journey, on any travel, any day, please do not travel. We should be responsible, and please let us do all the things that we need to do to keep our loved ones alive and to protect them. In that case, it is too early to down our guards. So we should continue pushing in order to remain alive. On that note, with the closing remarks from the chairman, the Secretary to the Government of the Federation, we come to the end of today's briefing. I want to thank everybody that has participated here today, and we pray to keep our hopes alive until we meet again next week, Thursday. God bless you.